Okay, good morning, good afternoon, good evening po sa lahat. Welcome to our 148 episodes of Stop COVID Let's webinar series brought to you by the University of the Philippines. Thank you for being part of our credible online community. And for those who have just discovered us for today, welcome po at sana po masiyahan po kayo at marami po kayong matutunan sa ating very interesting topic for today. Hospital dentistry in particular played a pivotal role in the battle against COVID-19. As an integral part of the healthcare systems, hospitals offered comprehensive dental services po, to cater to diverse needs even during the pandemic, with urgent treatments for severe dental pain, facial trauma, life-threatening infections being promptly delivered. Prioritize po yung patient well-being. And simultaneously, hospitals embrace a spectrum of procedures including oral surgeries, dental implants, and complex restorations, serving as beacons of hope and healing. And looking ahead, the training of future dentists will witness an exciting metamorphosis dahil na rin po the pandemic has propelled innovations and adaptations in dental education and blending traditional methodologies with cutting-edge technologies. Having dentists that are equipped po with these new skills, there will be a transformative shift po in the approach. And these novel approaches, enriched by collaborative networks and mentorship, will equip our future dentists with the skills and resilience needed to thrive in an ever-evolving healthcare landscape. I'm Dr. Raymond Francis Sarmiento, Director, National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. Always a pleasure to be with all of you during a regular Friday. And this week po, kasama na po ang aking partner, our adjunct research faculty at National Telehealth Center, internationally renowned public health communications expert, Dr. Susie Pineda Mercado. Dr. Susie.
Hi Raymond, good afternoon. Magandang hapon po sa inyong lahat. I'm actually here in Manila. And I really missed you last week, but I had a dental emergency, kaya talaga relevant no? So good afternoon sa lahat ng mga nakikinig. All of you who are here with us in the Zoom, welcome. And those who are watching on the playback, we also welcome you. We have several platforms, TVUP YouTube channel, TVUP Facebook page. We have the Stop COVID Deaths Facebook page, the UP System Facebook page, and of course, those of you who are watching from TVUP Signal TV Channel 101. So we are on mainstream television as well. In today's episode, we will delve into the remarkable journey of dentistry during the height of the COVID pandemic. And some of you might think it's not really that serious, but actually it is. I mean, I had a dental emergency, so I realized how important it is that we have dental services available. And we're going to explore the range of dental services and procedures available at hospitals and illuminate the transformative path of training of future dentists. I think our speakers today want to talk about that this pandemic has transformed the way they have been teaching. And we want to hear about that. And we welcome all the dentists who are with us today, listening to our top dentists at the Philippine General Hospital. Our speakers are, first of all, Dr. Roland P. Albanez, who is the Assistant Coordinator for Training at the PGH Department of Hospital Dentistry. He will be joined by Dr. Julian Eris N. Navarro, who is the Assistant Coordinator for Service from the same department. And of course, a reactor none other than the Chair of the Department of Hospital Dentistry, Dr. Maria Cristina Estrada. And our closing remarks and synthesis will be done by none other than Dr. Stella Marie Jose, PGH Office of Expanded Education and Training. All right. So we know that in our expanded billboard, we started talking about COVID only. And occasionally, we still come back and talk about COVID-related stuff. But we do talk about other things like other outbreaks, viruses, infections, disasters. And so we have expanded our discussions. And I know that many of you are looking forward to hearing the latest news from here and abroad. And it's for this reason that we bring you the news update.
Okay, for our very first news update, ito pong US CDC, Centers for Disease Control and Prevention, poised to create disease response network. They recently announced a new notice of funding opportunity via the Center for Forecasting and Outbreak Analytics aimed at enhancing outbreak response through data analytics and disease forecasting. So ito pong programang ito, it will leverage data and analytics-based approaches to build and scale outbreak response capabilities. And using these capabilities, decision makers hope to be able to better predict the trajectories of future outbreaks and more effectively detect, respond to, and mitigate any public health emergencies. How about you, Dr. Susie?
Well, May 31 is really the global observation of World No Tobacco Day. And I remember when I was in the World Health Organization, that was a huge mobilization. So the theme for May 31 World No Tobacco Day is Grow Food and Tobacco, which provides an opportunity to highlight the critical role of these interlinked determinants of health, including TB, and the need for collective multi-sectoral action to address them. It encourages governments to end subsidies for tobacco growing and instead use this for growing food and achieving food security. In 2021, there were 10.6 million who fell ill to tuberculosis. And a lot of them were undernourished as well. And so putting together these three topics, tobacco control, food production, and tuberculosis control really shows us that we have to think holistically about our health problems. And this was the theme for World No Tobacco Day 2023. So that's our news for today. Next week, we'll be back with more news on the News Update. Okay, and we are back. Raymond, we have a very interesting topic for today, but I think you want to introduce our persons on the street questions, because we always, TVUP puts together these questions for ordinary people. And Raymond, what were the questions they asked our audience? Yeah.
Thank you, Dr. Susie. So for this topic, we asked the common folks on the street, and for those who are asking, this one, just to set the tone and the context for our webinar, we asked the common folks on the street these questions. And for this week, we asked, anong kahalagahan ng pagpunta ng regular sa inyong dentista? Gaano po kayo kadalas pumunta sa dentista? At ano ang mga katangian ng isang dentist na gusto nyong puntahan? At ano ang mga karanasan sa dentista na hindi mo makakalimutan? Please watch this.
Mahalaga yun kasi part siya ng personal hygiene.
Ever since na nagpakabit ako ng braces, I have to be there every month. Pero prior to having my braces installed, I used to go there a few times a year.
Para sa akin, mahalaga talaga yun para sa hygiene natin, no? Lalo na sa amin, sa type ng trabaho namin, kailangan talaga maganda yung ngipin. So, inaalagaan talaga namin.
Mahalaga yung pagpunta natin sa mga dentista dahil sila yung nagpe-prevent ng mga oral problems katulad na sa ngipin or sa ating mga gums.
Ako personally, every month. Kasi required ako na bumalik sa dentist ko once a month. Kasi kailangan yun ng adjustment ng braces.
For maintenance, so that naiiwasan yung further damage to our teeth, we are able to hygiene, for basic hygiene, basically.
Minsan, twice a year, kasi yun naman talaga yung sinasabi ng dentist na kung kailangan ipa-check yung ngipin para kung ano man, meron mga sira dyan or something, hindi naman siya ganun kalala, maagapan agad.
Siguro once a month dahil naka-braces, pero ngayon siguro once every 2 months na lang siguro ako pumunta sa dentista.
Sa akin, yung very gentle. Kasi kapag adjustment, naramdam yan kapag may higpit yung kamay ng dentista. So, ayokong masaktan.
Siyempre, ang katangian ng isang dentist, yung lalo na pagka, nagbubunod siya, yung magaan yung kamay niya. Alam mo yun. Siyempre, yun yung pupuntahan mo na, di ba, ng medyo mas mataas ng konti yung pressure niya dun sa iba. Pero, importante kasi yung comfortable ka na sa dentista na yun.
isang hinahanap kong katangian sa isang dentista is yung magaan yung kamay niya. Kasi may mga ibang dentista is sobrang bigat ng kamay lalo na pag naglilinis. So, yun, madalas dumudugo yung sa gums.
My worst experience with the dentist is this time na I had an ache in my teeth. Tapos when I had it checked with the dentist, he drilled into my tooth. A week later, namaga yung gums ko, and then the pain was it increased. And then I tried to go back to that particular dentist, but then apparently he started hiding from me. So I had to find a new dentist. She fixed it naman.
Nung bata ako, parang pagbata ka natatanggalan ka talaga ng ngipin kasi nagpapalit. So nung nagpatanggal ako sa kanya ng ngipin, ayaw kong tanggalin kasi nga mabubungi. So nung pagkatanggal niya, sabi niya, yung tissue pinakita niya sa akin, tapos ginanon niya sa part na tinanggalan ng ngipin sa akin. Sabi niya, binalik niya na raw. So yun, tapos naniwala ako. Tapos pag-uwi ko, pagkatingin ko, bungi pa rin ako.
She explained to me that the damage to my teeth was caused by unhygienic equipment used by the previous dentist.
Magpa-check talaga kayo ng ngipin nyo. Kung halimbawa may masakit or something, ipa-check nyo na kagad kaysa lumala pa. Imbis na maagapan pa nila, kailangan alagaan nyo talaga yung ngipin nyo. Importante pumunta kayo ng dentista.
Kung ano yung importansya ng pag-check up sa ating mga katawan, ganun din yung importansya ng pag-check up sa ating mga ngipin or sa ating bibig.
Thank you very much, TVUP. It's always very interesting to hear what the person on the street is thinking. Of course, some of the stories were a little funny, but they're not funny, right? Parang, I don't know what to say, Raymond. Parang kanya-kanyang mga experience.
Yes,
yan.
yes.
And so we're going to learn more. We're going to learn more about dentistry, and we're going to learn more about how the dental profession coped with the pandemic. And as I said, we always have the best speakers. So, stay with us. Magagaling po sila. O Raymond, may housekeeping ka yata.
Okay, just a little bit of housekeeping rules po, no? Housekeeping items. There are those who are still asking, pero maybe I could count them in one hand na lang po. But just remember the certificates of attendance will be given to those who have watched at least 50% of the webinar duration. And we have at least 3 months or 4 months back, we have done a review of this, and we believe we have completed na po the sending out of the certificates of attendance for our webinars 147 and pababa. But please let us know if you still have any questions by emailing us at stopcoviddeaths@up.edu.ph. For our webinar today, we will have a standard panel discussion format after our speakers are presented, and then including our reactor that will be followed by a Q&A session. But before we delve into the webinar proper, here is our cute intro video for our fun quiz segment for today.
Hello? Hello? Hello?
Kumusta na kayo lahat?
Hi, I'm Doc Susie, the mini Doc Susie.
And I'm Doc Radar, the mini Doc Raymond. Are you ready to have fun? Simply open your browser to www.slido.com and enter your code to participate. We will discuss your answers during the panel discussion later on in the program.
We will have it flashing on your screen in a bit, and we look forward to your answers. Masaya at madali lang ito. Join na!
Talagang funny talaga yan, Raymond.
Lucis.
Ganun pa eh.
Okay, can we have it on the screen? Okay. And also in the Zoom po, no? For those who are joining us outside of the Zoom, you'll still be able to participate by opening up your browsers, typing in slido.com dun po sa address bar, and entering the code 6510096 when you are prompted. That is 6510096 for you to be able to participate in our fun quiz. We have 2 questions for today. The first question, anong mga serbisyo ang ginagawa sa hospital dentistry ng Philippine General Hospital? Letter A, pagtanggal ng impacted na wisdom tooth. Letter B, pagbiopsy ng mga bukol sa bibig. Letter C, pagbigay ng dental clearances sa mga cancer patients. Letter D, pagbigay ng paunang lunas sa mga dental emergencies. And letter E, lahat po ng nabanggit. We'd like to greet those who are joining us all the way from University of Rizal System in Morong Rizal. Dentista po siya. Another dentist from Legazpi City in Bicol Region. Maraming salamat po. Also another dentist from the Makati Health Department. Pati na rin po dentista sa Mayor Hilarion A. Ramiro Senior Medical Center in Ozamis City in Misamis. And then AFP Dental Chapter in Quezon City. Uy, marami tayong dentist na talagang attend sa ating webinar for this week, Dr. Susie. Also greeting those joining us from Bataan, from University of the Philippines, Visayas, CFOS, IFPT. Maraming salamat po. Joining us also from RPHS Annex 1 in Antipolo, Dr. Menzi Ramos. Maraming salamat. From Bataan, from UP, Los Baños. Thank you so much. From Bai in Laguna po. Maraming salamat. And there are those from the Philippine General Hospital as well. And those who are tuning in from Quezon City, Las Piñas City, Santa Ana, and from Iloilo City. So maraming salamat po. For question number 2, alin sa mga sumusunod ang hindi kabilang sa mga dental emergencies? Masakit ang ngipin noong 1 linggo o natanggal na pasta. Letter B, hindi tumitigil na pagdurugo mula sa bibig. Letter C, natanggal ng ngipin mula sa pagkahulog o pagkadapa o pagkabagsak. Or letter D, basag na panga. So may humahabol po. Good day from the Southern Philippines Medical Center in Davao City. Maraming salamat po. And our OFWs po, maraming salamat po sa inyong serbisyo at pagtulong po. Especially those from University of Ail in Kingdom of Saudi Arabia. From Vinmec International Hospital in Phu Quoc City, Quien Giang Province in Vietnam. From Chuanin Hospital in Taipei City in Taiwan. Lunichi Ali University of Blida 2 in Algeria. And Al-Meswak Dental Clinics in Taif, Saudi Arabia. So we will not be closing our fun quiz as we move on to our webinar proper. Dr. Susie.
Thank you so much, Raymond, and to all of you who continue to watch. We're just so grateful that you're here, and we've got some great speakers for you. So I know you're excited to get this discussion on the way. Let us introduce our first speaker. He is the Assistant Coordinator for Training at the PGH Department of Hospital Dentistry. Let's please welcome Dr. Roland P. Alvanez. Dr. Roland, welcome.
Hello, good morning, everyone.
Okay, go ahead, Dr.
Go ahead
Roland.
po, go ahead.
Okay. So thank you so much, Dr. Susie. First of all, I would like to thank TVUP because I think this is the ideal platform to raise awareness and encourage commitments and action to promote good oral health in the country, especially that here in the Philippines, we are the highest caries level in Southeast Asia. And I think as a hospital dentist, it is alarming that we need to promote good oral hygiene and impart education about correct oral hygiene practices. So sa totoo lang, ano nga ba ang hospital dentistry and what are we doing dentists doing inside the hospital? So ang mga sumusunod na minuto ay aking tatalakayin sa mga serbisyong isinasagawa naming mga dentista sa loob ng ospital, particularly in the outpatient department and sa emergency room. So here are the services that we particularly do inside the PGH. Tulad ng oral surgery o bunot at iba pa. We've been doing extraction, wisdom tooth removal and biopsy, telemedicine o ang pagsasagawa ng telekonsultasyon, which significantly improve the quality of healthcare by increasing the accessibility and efficiency through reducing the need to travel. We have patients from Bulacan, from Laguna, even from Visayas and Mindanao. So with the telemedicine, talaga pong nagagamit namin ang telemedicine, especially during the pandemic. Pagko-co-manage with other departments ng hospital, we've been doing co-management cases since then with some surgical divisions like plastic surgery, general surgery, radiation oncology, and medical oncology for clearances. At ang pagbibigay lunas sa mga pasyenteng may emergency dental complaints sa emergency room ng hospital. As a pioneering to have a 24-hour dental service in the country, we treat dental problem that requires immediate attention like dental traumatic injuries, dental pain management, and etc. Malamang po common knowledge na sa lahat ang pagsasagawa ng bunot sa mga pasyente. Pero bukod sa pagbubunot ng ipin, ang karamihan ng mga pasyenteng nagpapakonsulta sa amin ay ang mga gustong magpatanggal ng impacted teeth. Ang mga impacted teeth po ay mga ngipin na hindi lumalabas ng maayos sa loob ng bibig na nakatakot sa takdang edad. Ito ay maaaring nakatago o partially na lumabas pero hindi naka-upright. Among sa mga ngipin na usually nagiging impacted ay ang mga third molars, also known as the wisdom teeth. Ito ang isa pang halimbawa ng isang impacted teeth sa ngipin as can be seen on the x-ray. At ganito po namin siya tinatanggal. Ang pasyente na ito ay lumalapit sa amin dahil sa edad niya ay hindi pa tumutubo ang kanyang mga pangil at premolars. The procedure includes cutting into the gums to expose the impacted tooth and bone area covering the tooth. In some cases, the procedure includes drilling into the bone or yung sectioning to access the tooth more easily. Sections of the tooth may be removed piece by piece. In some serious cases, may require general anesthesia, but however, in regular cases, local anesthesia will be enough to complete the procedure. Isa pa sa mga serbisyo na aming ginagawa sa Philippine General Hospital ay ang pagtukoy o pagdiagnose ng mga bukol sa loob ng bibig. Bago bigyan ng karampatang lunas ang mga bukol, kinakailangan munang matukoy kung anong klaseng bukol ito. At para ma-determine ito, nagsasagawa po tayo ng isang biopsy o ang pagkuha ng sample mula sa bukol para makisigurado at na ang ibibigay na lunas, surgical man o sa pamamagitan ng conservative na paraan, ay akma sa klase ng bukol na mayroon ang pasyente. So ang pasyente po na ito ay dumating sa amin na may facial asymmetry o di pantay ng muka. Binuksan namin ang bukol at kumuha kami ng maliit na sample upang ipabasa sa pathologist at matukoy ang bukol kung benign ba ito o malignant. This is a case of a 40-year-old female, a diagnosed case of adenomatoid odontogenic tumor. So this lesion is most common located in the anterior maxilla and rarely in the mandible. It is usually associated with the impacted canine. May iba-iba ding klaseng bukol at pagmamanage sa isang bukol sa loob ng bibig. Maaari itong paliitin, tanggalin sa pamamagitan ng surgery at marami pang iba. Again, depende sa klase ng bukol. We completely remove all the cystic capsule by means of enucleation sometimes. Madako naman tayo sa co-management. Maaaring lingid sa kaalaman ng lahat, may role din po kaming mga dentista sa medical management ng mga pasyenteng may iba't ibang uri ng sakit. To secure a dental clearance prior to a specific intervention for the head and neck radiotherapy, chemotherapy, open heart surgery, organ transplant, MRI, and rule out sources of infection. Para sa mga pasyenteng may cancer na nangangailangan mag-undergo ng bone therapy or radiation therapy, we evaluate their and treat their dental infection para maiwasan ang mga komplikasyon tulad na ito. So achieving a state of oral health is regarded as an essential treatment goal before radiation therapy to prevent complications like osteoradionecrosis, the most feared side effects of radiotherapy. Para naman sa mga pasyenteng nangangailangan magpa-heart surgery at kidney transplant, nire-refer sila ng kanilang mga physician sa amin upang lunasan ang mga ngipin at iba pang kondisyon sa loob ng bibig na maaaring panggalingan ng impeksyon habang at matapos ang kanilang surgery. Kailangan po nating tandaan na ang pagkakaroon ng perioperative dental infections ay maaaring resulta ng endocarditis o ang infection sa puso o pagka-reject ng transplant. Bukod dito, in relation sa mga gamot na ibinibigay after organ transplant, maaaring humina ang kanilang resistensya o maging immunosuppressed at lumala ang kanilang mga dental infections. Cardiac valve surgery involving both native and prosthetic valves exposes the patient to an increased risk of postoperative endocarditis. And infection of oral cavity is recognized as a potential cause bacteremia contributing to the occurrence of infective endocarditis. Kung may mga pasyente naman po ang mga ibang departments sa loob ng ospital na nangangailangan na pag-rule out ng mga possible sources of infection, isa din po ang Department of Hospital Dentistry sa nare-referan nito. Bukod sa mga ito, ang mga pasyenteng nangangailangan ng MRI ay kailangan din ng dental evaluation upang ma-rule out na may bakal sa loob ng bibig. Artifacts caused by dental restoration such as dental crowns, dental fillings, orthodontic appliance are common problem in MRI and CT scans of the head and neck. MRI is considered contraindicated in patients with ferromagnetic metallic implants and other ferromagnetic materials, primarily because the potential risk associated with movement or dislodgement of these objects. May mga pasyente din pong maselan ang kondisyon at nangangailangan ng dental treatment in the hospital setting. In treating medically compromised patients, we considered po a lot of things tulad ng pagkakaroon ng more tendency to bleed, capacity of the patient to breathe, or ang capacity nila to ambulate o ang makatayo at makalakad. We also treat patients na hindi basta-basta po magagawan ng procedures due to their behavior or medical conditions. Halimbawa po nito ay ang mga patient nating may intellectual disability or sakit sa puso at iba pa. Part din po sa aming co-management efforts ang pagbibigay ng mga lunas sa mga nabali, di lamang sa mga ngipin but also sa panga at muka. So ang pasyente po ito ay isang 20-year-old male na nirefer sa amin ng trauma surgery for co-management. Tinulungan namin sila upang ibalik ang kanilang kagat ng pasyente nang sa gayon ay maibalik din ang mga functions. Tulad ng eating at speaking na kapag naghilom na mula sa operasyon. So dito nagamit po tayo ng wires and arch bars pati na rin po ng mga splints na mukhang pustiso para mag-guide sa normal na kagat ang pasyente habang inooperahan. So ito po ang larawan ng kagat ng pasyente before and after the surgical operation. Yung nasa taas po ay matapos ang aksidente at yung nasa baba naman po ay pagkatapos niyang maoperahan. This is a case of a 24-year-old male assessed with multiple injuries secondary to vehicular crash, revealing a mandibular fracture from right ramus and left body. Ito ang samples ng aming training at simulations ng procedures para sa pagbabalik ng kagat ng pasyente na isinasagawa namin sa isang dental model. So interdental wiring and maxillomandibular fixation that is very important in the treatment of maxillofacial fractures before the placement of plates and screws. And it is usually applied by wiring together the fixed upper and lower jaw to have a good occlusal harmony. Importante po ito. May mga kaso din po kung saan sa laki ng bali o ng bukol sa isang pasyente, kinakailangan po natin hatiin ang kanilang panga at i-reconstruct sa pamamagitan ng bakal at grafts tulad ng sariling buto at skin ng pasyente mula sa iba't ibang bahagi ng katawan, which is a co-management case. Nirefer po sila sa amin during the operation. Tulad po ng kanina, gagawa po kami ng splint at wiring upang manatiling normal ang kagat ng pasyente. After the surgery po, we do prosthodontic rehabilitation to achieve aesthetics, phonetics, and most of all the proper use in the mastication process. Another surgical procedure that we join in ang mga pagsasagawa ng palatal obturator. May mga cases din po ang mga surgical divisions kung saan nangangailangan butasin o ayusin ang alangala ng pasyente. Tumutulong po kami sa pag-manage ng pasyente sa pamamagitan ng paggawa ng postiso na maaaring gamitin upang suportahan ang wound dressing na ilalagay sa ngalangala at itinutuloy namin hanggang sa paggawa ng postiso na mag-restore ng ngalangala, ngipin at pananalita ng pasyente. May mga cases din po kung saan may mga batang ipinapanganak na may cleft sa ilong at sa bibig tulad nito. Nasoalveolar molding arch utilizes wires and acrylic nasal stents attached to an intraoral denture. So this appliance is used to mold the nasal cartilage, premaxilla and alveolar ridges into normal form position during the neonatal period. In effect, this surgical management of the cleft infant is intended to reduce the severity of the oronasal deformity prior to cleft surgery. May mga kaso din po na ipinapatawag kami sa operating room upang magbunot ng ipin habang ang pasyente ay inoperahan sa head and neck area. Part po ng aming practice na always on call, hindi lamang sa clinic, sa emergency room, kundi pati na rin po sa OR. Kung mapapansin nyo mula sa diskusyon ng mga co-management services na aking tinatalakay, involved po ang aming department sa pag-manage ng mga pasyenteng may iba't ibang uri ng kondisyon. Dito po sa Philippine General Hospital, aming pinapahalagahan ang multidisciplinary o ang multi-specialty management ng isang pasyente upang maisalang-alang ang holistic na paggaling at pag-improve ng kanilang quality of life. Madako naman po tayo sa uri ng consultations na aming isinasagawa. Simula po ng pandemic, di lamang po face-to-face o conventional consultations ang aming ginagawa. For triaging purposes, patient follow-ups at facilitation of referrals to medical and surgical departments. Nagsasagawa po tayo ng konsultasyon o telekonsultasyon para sa ating mga patient. Even as we normalize post-pandemic, aming po pinagpapatuloy ang practice na ito upang maiwasan ang mahabang pila at pagod ng pasyente. Sa pamamagitan nito, iuugnay rin namin ang mga pasyenteng nangangailangan ng medical clearance prior to dental procedures sa mga concerned departments. And last but not the least po, we are also involved in the management of emergency cases. Sa aming department, we have 24-hour duty in the emergency room for timely management of emergency cases. Ang mga sumusunod po ay ang mga dental emergencies na aming tinutugunan sa emergency room, like your acute dental infections, tulad ng pagsakit ng ngipin o gums na may kaakibat na lagnat, extraoral na pamamaga, or hirap sa pagnganga. Severe bleeding that cannot be controlled na nanggagaling sa gums, teeth, o post-extraction socket. And traumatic dental injuries o ang pagkabali, pagkauga, pagkausli o pagkatanggal ng ngipin dahil sa trauma. So sa kaso pong ito, umusli po ang ngipin ng pasyente dahil natamaan siya nang siya ay masuntok. So amin pong ibinabalik sa normal na posisyon ang mga ngipin at ikinakabit po sa pamamagitan ng splinting. Tinahi po namin ang lacerated na gums upang ito ay maghilom ng tama. So that would be all po for the services of the Department of Hospital Dentistry. Thank you so much for listening.
Wow, thank you so much, Dr. Roland. Ang ganda ng kanyang presentation. No? Ako, I really appreciated
ma'am.
all the... I really
Yung
appreciated
mga pictures,
all the-
very helpful, Dr.
Diba
Roland.
yung visuals, no? Ganda, Raymond. Parang, sabi ko, ang hirap din ang ginagawa ng mga hospital dentist natin eh. Hindi, it's not easy, no? And
Yes.
so, it's really helping us appreciate your specialization tsaka yung tulong na nagagawa nyo sa mga nangangailangan. Maraming salamat, Dr. Roland. So, Raymond, let's go to our next speaker, please.
Thank you, Dr. Albanez, and thank you, Dr. Susie. Before we go to our next speaker, just a reminder, we will be choosing po from the upvoted questions, yung mga tanong po, is not just in the Zoom, but also in YouTube and in Facebook. So we encourage everyone to start typing in your questions, whether here in the Zoom Q&A or in the comment section of Stop COVID Deaths or TVUP Facebook pages or in the TVUP YouTube channel. Now, on to our second main speaker. She's the Assistant Coordinator for Service at the PJ Department of Hospital Dentistry. Please give a warm virtual welcome to Dr. Julian Eris Navarro. Dr. Eris.
Maraming salamat for your introduction, Dr. Raymond. So, noong March 2020, idineklara ang Enhanced Community Quarantine o ECQ sa Metro Manila bilang response sa COVID-19 pandemic. Dahil dito, pansamantala rin isinara ang PGH-OPD. Tulad ng binanggit ni Dr. Albanez sa unang part ng webinar na ito, karamihan ng mga pasyente ng hospital dentistry ay outpatients at dahil dito, pansamantala ring nagsara ang aming department. Ngayon naman, nais kong ibahagi sa inyo ang mga naging pagbabago sa aming department noong panahon ng COVID. Magandang tanghali sa inyong lahat and welcome to the second part of our presentation, Hospital Dentistry in the Time of COVID and Beyond. So malungkot mang pansamantala nagsara ang dental OPD noong March 2020, agad din kaming nakapagbalik ng face-to-face appointments by July 2020. So ano ba yung mga safeguards at pagbabago na aming ginawa upang mapanigurado na maibalik namin ang pagbibigay ng serbisyo sa loob ng ospital habang iniiwasan ang risk for COVID-19 infection among both patients and hospital staff? I will be discussing engineering controls, administrative controls, at sa ilalim nito ang mga practices and procedures na aming ginawa. Siyempre, hindi rin mawawala ang personal protective equipment. Basically, lahat ito ay batay sa hierarchy of controls, isang approach para mawala o mabawasan ang risks at hazards. So it is also important to note na lahat ng mga plano at pagbabago na aming isinagawa para mag-resume ang clinic operations at kahit yung mga protocols namin ngayon ay closely coordinated with the Hospital Infection Control Unit. So dako tayo sa engineering controls. Nandito po yung modifications and considerations para sa current structure and setup ng dental clinic. Under this category din yung mga equipment procured and used para maiwasan ang pagkalat ng COVID-19 infection. As we might all know, prior to the pandemic, ganito ang setup sa PGH. Long lines, sikan. Noong panahon ng pandemic, sumunod tayo sa community-wide protocol of physical distancing. So we had to reduce the number of benches to increase the spacing in between patients. At dinarekahan din namin ng areas kung saan maaring umupo ang patients. Pati yung floors, nilagyan ng arrows bilang gabay sa patient flow. So in cooperation to with the Department of Outpatient Services also. In-identify din namin ang mga areas sa clinic and group them into different zones para ma-lessen ang cross-contamination between clean air spaces and possible contaminated air spaces sang-ayon po sa coding zones ng ospital. So, nakamarka ng green ang mga areas presumed to be clean. Orange naman para sa mga lightly or moderately contaminated. At red naman para sa most likely highly contaminated, specifically yung dental operatory dahil ito po yung area where we treat the patients and ask the patients to remove yung mask nila. So inilipat din namin yung tanggapan ng pasyente from the door ng operatory o sa loob ng operatory to the window na available sa aming staff room, which also served as the triaging area. Aside from having a designated donning area, due to the space availability in our operatory, nag-install din kami ng doffing area katabi ng exit door. Tapos this was to ensure that we had a unidirectional foot traffic o isa lang yung daluyan ng mga pasyente at dentista to avoid cross-contamination between the different zones. And so maswerte din kami kasi yung clinic namin merong mga malalaking bintana adjacent to the operatory. So this contributed to the much needed environment ventilation required at that time. So nagbubukas kami ng bintana near the chairs for ventilation din. Our clinic was also equipped with exhaust fans in the areas that were not adjacent to windows. So we made sure they were clean and functional sa pamamagitan ng coordination with the hospital's Office of Engineering and Technical Services or OETS. Ito naman po yung layout ng aming clinic. So tingnan niyo yung location ng exhaust fans, part EF, and yung location ng aming windows. So given the size of our 12-chair clinic, kino-ordinate namin with OETS if we had sufficient ventilation to operate. Kung mapapansin nyo, yung aming staff room, kung nasaan yung triage window din, wala masyadong ventilation. So itong layout na to was used to justify a request from the admin for an air purifier. And with the admin support and generosity, kami ay nagranta naman ng air purifier along with other departments in PGH. So this helped with the ventilation. Additionally, we also procured other equipment such as extraoral vacuum para sa mga aerosol generating procedures and UV light units pang disinfect din ng area. So, iyon po yung mga engineering controls na in-apply namin sa aming clinic. Admin controls naman, yung mga kino-cover nito yung mga protocols to change how people work. Here, we underwent training and made changes sa workflow ng aming clinic as well as patient management flow to minimize the risk of contracting COVID-19. In this part, I will give emphasis din po later on is the basis on the practices and procedures that we implemented and continue to implement as of current. So in preparation for the resumption of OPD operations, some of the staff underwent training on biosafety, as well as oropharyngeal and nasopharyngeal swabbing. We also sought donning and doffing training mula sa PGH Division of Nursing Education and Training, in which all staff, including yung mga admin personnel ng aming department, participated. Tapos everyone in the department also underwent mask fit testing under the Hospital Infection Control Unit. Gumawa din kami at nag-implement kami ng mga bagong workflows para sa mga dentist, staff at pasyente. Ngayon, ibabahagi ko naman ang mga specific practices and procedures na batay sa aming mga sinet na administrative control. Tulad ng nabanggit kanina and kasama rin sa PGH telemedicine efforts, nagsimula po kami ng teledentistry. Hindi lamang po para sa patient convenience but also to decongest the waiting area and maintain physical distancing. Meanwhile, sa dental operatory, kung mapapansin nyo, meron kaming open plan na disenyo ng clinic. Ito po ay nangangahulugan na walang sari-sariling kwarto ang bawat dental chair, bagamat merong wall sa pagitan ng mga ito to maintain patient privacy. However, yung height po ng wall namin ay hindi akma sa standards to mitigate cross-contamination between air spaces. Kaya nung kasagsagan ng pandemic ay nag-identify po kami ng workstations. So from 12 chairs, 6 hanggang 7 chairs lamang ang aming ginagamit to maintain the physical distancing between workstations. Tapos yung mga pinili naming chair, yung malapit sa exhaust or malapit sa window. Bukod po sa telekonsultasyon, nagsagawa din po kami ng telescreening 1 araw bago ang appointment ng patients. Ito po ay para masala namin kung may sintomas ng COVID ang mga pasyente at mabigyan sila ng kaukulang request para makapagpaswab for RT-PCR testing. So hanggang ngayon, pinagpapatuloy namin tong practice na ito upang maiwasan ang hawahan, lalo na sa pagitan ng mga pasyente dahil lahat sila nakatanggal yung mask sa clinic tapos naka-open yung bibig nila. Bukod po sa pagtanggap ng pasyente, kami ay nagsasagawa rin ng screening at pagkuha ng vital signs sa triage window upang mabawasan din kahit papaano yung oras na nandun sila sa loob ng operatory. So pagpasok nila sa kanilang dentist, meron na silang vitals. Hindi na yung dentist yung kukuha inside the operatory. Ilan sa mga practices at procedures na aming in-establish noong July 2020 at nakitang epektibo tulad ng telemedicine, telescreening, pinagpapatuloy namin hanggang ngayon. Samantala, dahil sa pagluwag at sa mga bagong protocol ng Hospital Infection Control Unit at upang ma-maximize din ang serbisyo na mabibigay namin sa mga pasyente, sinimulan na namin muling gamitin lahat ng 12 chairs sa aming dental operatory. Dumako naman tayo sa personal protective equipment o PPE. O para sa PPE, aming sinusunod yung latest na panuntunan mula sa Hospital Infection Control Unit. So nung nagbalik ng serbisyo ang dentistry noong July 2020, ang paggamit ng bunny suit o tinatawag na coveralls, ayan, naka-double gloving, pagsuot ng booties o cover ng footwear, face shield, goggles, at N95 respirators, yung aming naging regular na PPE, lalo na sa mga aerosol generating procedures. Ito rin yung extraoral vacuum namin. Ngayon po, kami ay nagamit pa rin ng wastong PPE, lalo na yung tamang mask dahil Sa dentistry naman talagang karamihan ay aerosol generating procedures. Pero ngayon, yung PPE namin mas akma na sa area of duty at sa procedures na gagawin, batay din naman sa latest HICO guidelines. Yan. Kung interesado kayo para makita rin yung mga latest na recommendations ng Hospital Infection Control Unit, pwede nyo tignan yung kanilang Facebook page sa facebook.com/pghhic. So dito na nagtatapos ang aking pagtalakay ng mga pagbabago sa hospital dentistry sa kasagsagan ng COVID-19 pandemic at ngayon na hindi na ito public health emergency of international concern. So sana mas na-appreciate nyo yung thought process that went into these changes, lalo na siguro kung nagpupunta kayo sa mga dental clinics ngayon, makita nyo ang dami ng bago, may mga bagong equipment din, tapos yung mga PPE ay iba na rin. Unlike before na naka-surgical mask or scrubs or minsan nga casual wear lang yung dentist. So ngayon, iba na talaga simula nung nagka-pandemic and it's a good thing also. So, but before I end this presentation, nais ko munang i-share sa mga gustong kumonsulta sa PGH Hospital Dentistry kung paano po makapag-konsulta sa amin gamit ang online consultation request o OCRA. So ito po ang website ng OCRA at ito yung link para sa website. Kung may account ka na, log in lang ng credentials at kung bagong pasyente naman, i-click ang katagang magrehistro dito. So, ito din po yung efforts ng PGH para mag-telemedicine. So, pag nakapasok na kayo, gawa lang kayo ng new consultation under sa general concern. So, nandun po yung dentistry or dental concern. So, pagkatapos nito, maghintay lang kayo ng text mula sa Dentistry, Hospital Dentistry, at tatawagan namin kayo para sa inyong telekonsulta. Sa inyong telekonsulta, kung nangangailangan, doon namin kayo bibigyan din ng face-to-face appointment. Tsaka yung instructions kung ano yung mga protocol sa aming clinic. So, salamat po sa mga photos, credits, and content credits. At salamat din po sa pakikinig at mag-ingat po tayong lahat.
Thank you very much, Dr. Ed. Raymond, ang ganda rin,
Maganda.
Maganda, sabi ko nga, my goodness. Ang dami talaga nilang, hindi natin masyadong naisip, no? Pero mga dentist, tsaka yung mga ENT, talagang malapit sila sa mouth ng mga tao, di ba? And, tayo, nagdi-distance sila, lapit-lapit. So, all of the modifications they had to do, it's really so praiseworthy. Parang, sabi ko nga, it's amazing what you have done.
That's true. Especially since maaga po silang nakabalik, no, July 2020 kagad. So yun po yung, that always resonates with me. Parang, mabilis nilang nakabalik kagad sa with
matapang.
Matapang. Yes.
Sila maganda yan. O sige, so let's go to our reactor, none other than the chair of the PGH Department of Hospital Dentistry. Alam niyo yung mga chair ng mga departments. Ang laki-laki ng challenge nila, no? Kasi on the one side, they want to open services. On the other hand, they want to make sure that all the health workers are protected and don't get sick. So I don't envy their responsibility. I really appreciate everything that's been done. And I think in this case, talagang kudos to our chair of the Hospital Dentistry Department for all that you have achieved. And we'd like to hear your reaction. Go ahead. So this is Dr. Maria Cristina Estrada. Go ahead.
Good afternoon po. And maraming salamat po sa pagkakataon to represent this Hospital Dentistry of PGH. Well, just to react, lahat po ng nakita nyo, nabasa nyo are totoo. And until now, it is continuously being given in our department. So what I may say is we survived COVID po. We really survived. And it has also been a success because lahat po ng hiningi namin were well given by the PGH administration po. And then what else can I say will be the strengths of our department, ang maganda lang po sa amin is may mga pasyente po. Hindi po kami naghanap. Talagang dagsa po ang pasyente sa amin, and the strength to have a co-management po is very strong among us. I'm also very lucky, our department, is that we have 7 dedicated and reliable consultants always with us po. And we have good facilities and equipments. And gradually po, we are having a slow increase of trainees. Marami na rin po ang nag-a-apply. And most of all, I may say that only PGH have dental ER. Kaya po, that is something we have to be proud of, and it has really helped a lot, not only in service, but also in our training po. So are there any problems? Meron po. Marami po kami naging problema, but this did not stop us. We learned from that. We learned from the experience po. And we continue with this service and training. And something to add po, since there are future plans of PGH to have the CI building, we will really come up with or formalize dental oncology as what you have seen po about clearances ng cancer patients. And we continue with our training sa oral surgery. Dental trauma and the rest po. So we continue to serve, really most of them are really charity patients, and we are happy with
I think nag-freeze Raymond, ano?
that po.
That's correct.
Salamat
that's
po.
correct. Yeah.
Okay, I think we have Dr. Estrada back. Dr.
Yeah.
Estrada, we lost like
Wow.
2 minutes of what you said. So
Mhm.
yung last
Oh.
few sentences po ninyo.
Alin po, sorry, but it's about the upcoming projects of PGH.
Yan.
Yes po, yes po.
Yeah.
Yung dental
That's
oncology,
one.
Dr. Estrada.
Yes. Yes, there are plans of putting up the CI building, and we will keep abreast with that by formalizing also dental oncology. Dental oncology po. And the rest, we continue po. So this, generally, our patients are really charity patients and the patients.
Okay. Thank you
Okay.
so much, Dr. Estrada. Thank you so much for that. And to our other speakers, maraming salamat. You see the appreciation of our audience on the chat. Talagang nagpapasalamat sila, no, sa the time that you put into making the presentations and sharing knowledge. But we're not ending here. We're going to go into our open forum. So we're going to ask everyone to open their cameras, our speakers. But meanwhile, Raymond has a public service announcement. Go ahead,
Yes.
Raymond.
Yes, thank you so much. We'll take a very quick break lang po for a special public service announcement for today.
Ay, ate, gusto ko nang lumabas at makipaglaro.
Eh di ba magkakasakit daw tayo kapag lumabas?
Magpe-face mask naman ako eh.
Kahit na, hanggat wala daw tayong injection, hindi tayo pwedeng lumabas at maglaro.
Ano ba yan? Takot pa naman ako sa injection.
Huwag ka mag-alala. Parang kagat lang daw ng langgam yun.
Talaga? Eh, natatakot pa rin ako.
Eh di sabay na lang tayo.
Pa-injection?
Oo, syempre. Loves kita eh. Para makapaglaro na tayo.
Dahil mahal ko kayo, magpapabakuna ako.
Kaya mga bata, magpapakuna na kayo.
Stay safe and stay well. Mga bata, magpasama na sa Bakuna Center. Thank you so much, TVUP. The COVID communication public service announcement is just one of the many creative outputs of the Stop COVID Deaths team to push for vaccination, but especially for pediatric vaccinations, children age 5 and above. Please share this video clip with all of your social media accounts. Stay safe and stay well. Magpasama na po sa Bakuna Center. Let's start the ball rolling, Dr. Susie, with our first question.
Okay, so we've got a number of questions in the Q&A box, but I wanted to get kind of like a reflection from each of you on your level of stress and how you were able to cope, no? Because you opened immediately. You opened within 2 or 3 months, no? You're probably one of the first subspecialties that went into full gear, no? And I'm sure to this day, you still have your own concerns about your health, your family. So what was it like when you started? What was your how should I put it? Parang what was your experience in terms of stress and anxiety, and how did you cope with this, and how did you allay also the fears of the students? So we'll start with Dr. Roland.
Hi, Dr. Susie. Well, it's very difficult, no? Kasi during sa peak po ng pandemic, we don't have trainees, okay? We 7 consultants, kami lang po yung nagwo-work. So it's very difficult. We need to work on the admin. We need to cater the charity patients and etc. So we are very lucky and we are very blessed kasi may mga pre-provide naman kami ng Philippine General Hospital sa mga gamit and etc. So yun lang po.
Pero parang nakita ko, you're using the one na merong oxygen, di ba? Yung mask nyo may oxygen, yung katulad sa
Yes
Grey's
po.
Anatomy.
Yes, respirator po. Opo.
Meron kayong ganon, ano? You
Yes
had that
po.
when you started, yeah. Okay, how about Eris? What was your experience?
Mahirap siya, lalo na when we got back and nakita nyo dun sa presentation kanina, we were in level 4 PPE, we were wearing, kasi we had the mask fit tested, so either N95 na fit talaga sa'yo or yung elastomeric. Tapos,
Naku.
ang init dun sa clinic kasi yung ventilation nga yung isa sa main concern. And then you'll attend to, yung unang mga patients na inattenda namin were cancer patients for dental clearances. So these patients, syempre medyo hirap din talaga sila kasi they're in pain. So isipin mo, you're wearing all those, tapos
Yeah.
ang init in those
Oo.
months. And
Yeah.
then yung patients mo rin, you want to give them comfort, pero yung procedure niya is multiple tooth extraction. So,
Yeah. Yeah.
nag-adjust talaga lahat, pero we got through naman.
Yeah.
Ayan. So,
Yeah. I mean,
tsaga
when I look at it, di ba, you are operating in a very small field. Di ba? So
yes.
kung mainit na mainit and uncomfortable, parang sabi ko,
Yes, and we were also wearing yung goggles, eyewear
oh my
during the
gosh.
start.
Yeah.
So, nagfa-fog yung vision mo while you're attending to patients. So, for me, yun yung pinakamahirap. Besides yung ang init nung PPE, yung vision talaga.
Nako, pero ang galing ano, talagang kahanga-hanga. Okay, Dr. Estrada, what was your experience? Nako, mahirap ang mga department chair. Sige.
Okay lang ma'am, kasi po we really help each other. Tapos before July, so sometime April, May, June, that was the planning stage. Nagplan na po kami because our main concern would be patients in yung urgent po. So we identified yung may bukol and we really thought of the cancer patients kasi po ma-delay and kawawa naman po. And luckily when we asked permission to proceed, na-grant naman po ng administration po. And we also have a safety officer to remind us po, yung mga ganyan. Meron din ho kaming test.
Napuputol si Dr. Estrada, no, Raymond?
That's true. But I think it's more of her internet connection naman.
Yeah. Okay. So I think
Yan. Nagte-tracino. Tapos minsan, isa lang po, pero immediately the next day, 3 ang wala kasi sila yung naging direct contact. So yung very unpredictable, but I think that is where the strength came in us na laging handa po. Ganun talaga. And what we have observed, hindi ho sa amin talaga nang gagaling ang pagka-positive. Usually po during that time, sa labas sila nag-positive for other sources, but not within the duty hours po sa dental. That's something
Yeah,
we...
that's what we
Yes.
saw also before, Raymond, no, sa PGH. Na nahahawa yung mga health workers natin sa labas, sa
Opo.
community. Pero within the so it's good to go back to these lessons and reflect and learn from them, no? So okay, so we're gonna move now to questions from the audience, and hingi sana ako ng paumanhin sa inyo because I have to leave. Raymond, I have to leave you, but Stella's around. And I think you've got a good discussion going, but I'll be with you guys next week. Paumanhin lang, I need to leave. And thank you so much to everyone who's been on the program. Maraming salamat sa inyo. Raymond, take it away.
Thank you, Dr. Susie. So for our next question po, I'll post this to the chair. Question from one of our regulars, Dr. Tortona. Will the Department of Health require dental services for all hospital-level designations, and will PhilHealth cover those expenses po via package deals?
There are procedures po na covered na meron na kaming PhilHealth accreditation, but if I talk to other hospital dentists, ang problem po nila will be budget.
Budget, okay po.
Budget,
okay po.
yes. And honestly po, wala kaming problema sa PGH. Wala po. Well, I may brag that we were able to get top of the line dental chairs. So I just want to correct the idea po na sasabihin nila, pag gobyerno, mura ang kinukuha. No, not with us. Because even if we are a government hospital, naipasa po namin ang top of the line dental chairs. So hindi ho reason na basta gobyerno mura ang bilhin, makakapasa sa bidding, not with us po. So yun lang po ang gusto ko i-correct na mentality, hindi po.
Thank you. Thank you, Dr. Estrada. Several more questions, but a little bit on the ordinary side po, we'll ask it to... sorry, there's a comment from Dr. Eris po muna before I ask the next question.
Would just like to add, I'm not sure kung ano yung current guidelines ngayon, but in 2018, level 2 hospitals in the OH, they are required to have a dental clinic.
They are required to have a dental
Level
clinic.
2 and above.
Okay, so hopefully there that answers the question from Dr. Joseph Tortona. Dr. Tortona has been one of our avid viewers and very thankful to the support that he has been providing through the years po, no. Next question that we have will be about deep scaling. So I'll ask this to Dr. Roland. Gaano daw po ba kadalas ang deep scaling, Dr. Roland?
Well, when you talk about deep scaling, it's when you're dealing with gums. So it's a case-to-case basis. Okay, so first we need to diagnose and we need to assess kung gaano ka-severe yung kaso, okay, before we do deep scaling, and kung akma ba siya for a deep scaling. Okay, so it's a case-to-case basis, Dr. Sarmiento. We need to see the patient first in order for have a good treatment planning.
Okay, thank you, sir. Since I have you and I have a phone-in question actually. One of the questions was about, and I think this is from someone who is interested into going to dentistry. So they wanted to ask, what is parang a day in the life of someone who goes into like emergency, yung hospital emergency duty? Ano daw ba yung mga kaso na titignan? Hindi ba kayo natutulog? Those types of questions, Dr. Roland. I think that's something na, as the assistant coordinator for training, ano ba yung may kukwento nyo, sir? For someone who is a prospective dentist, Dr. Roland.
Okay, so being a dentist, it's a rocky road, no? When you enter the pioneering oral surgery training program in the country, number one, you need to go beyond. Okay, there are so many cases that you will encounter. You need to be tough. Okay, it's a character training, so wala talagang tulugan because of the load of the patients. So lalaban lang talaga. And then one thing, pag nag-hospital, when you enter the hospital dentistry program, you will experience cases na out of the book or mga nasa librong mga cases. So yun, you need to be tough, okay? Because this is character development training somehow.
Pero kunyari, let's say if you go into like an emergency duty, Dr. Roland, madalas ba yun nangyayari, and how is the coordination between the specialties? Maybe it's ENT to dent or general surgery to dent. How does that happen po? At least for PGH.
Okay, in emergency dental services, Dr. Sarmiento, it's rotation. It's just like the rotation of the program in medicine. Okay, so we have a certain rotation wherein we have emergency duties for 24 hours. And then we have co-management depending on the referral cases. Sometimes it's with the plastic surgery, general surgery, radiation oncology, and medical oncology. So usually yun yung mga nagre-refer sa amin to address their cases, sir.
Okay, thank you so much. Next question, but this one is coming from me. I heard from Dr. Estrada. I'll ask it to Dr. Eris. I heard from Dr. Estrada that you are only like 7 consultants, no? And since magkakaroon na po ng dental oncology, what are the plans in terms of lumago po kayo, dumami po kayo? Siyempre, since there will be another, let's say, another group who should be manning that part, and how will you be able to maintain your current services that people are availing of in the department po?
I think mas masasagot to ni Dr. Estrada. But just to give you an idea, dun sa department namin, we have a training program in hospital dentistry and oral surgery. So these externship program kasi siya, these externs, they are like the equivalent of residents sa amin. So they attend to the patients and we supervise them, we have case discussions and we guide them. So ayun, as of now naman, although syempre it's really given naman sa PGH, ang dami rin kasing bulk ng patients. But in terms sa mga cancer patients, there are priority and na-attend na naman sila.
Okay.
But for future plans, I think mas masasagot din ako.
Sige po. Dr. Estrada, before I ask the next question po.
Yes, sir.
Yes, ma'am. Yung plans for like additional consultants, ma'am, since medyo konti lang po kayo, kung 7 lang po, and then you'll have another dental oncology work po.
Sir, pinaghahandaan na po namin.
Yan, okay.
Yes, yes. You know, we still have, well, allotted with us are 8 items po. 8 items. So it's just one. And I may say na lahat po yan na nasala, alam ang gagawin. Wala pong, hindi yung priority ang private patients. Kasi po kung nahahaluan yan, wala. We cannot really deliver a good and keep the department strong. Well, sir, talaga handa dapat. And like to augment the question, lahat po ng mag-a-apply, we expect, alam niyo yung papasukan niyo. Yun po. So, they ask, ganyan. Pero tumitibay, sir, honestly, tumitibay sila and they become better with more social awareness na ito ang totoo. And at the end, they end up na maswerte sila. Yung nagiging, itong reality, sir, if they nakakasalamuha ang lahat ng mga charity patients. So yun din po ang growth sa amin. It's not only the training and the skills, but they become better person po inside.
Thank you. Thank you so much, Dr. Estrada. And speaking of charity, there's a question here from Ms. Zenaida. I'll ask it to the Assistant Coordinator for Service. In cases for charity, what are the needed requirements to avail of dental services such as impacted tooth removal?
Okay, thank you po for your question. I see 2 questions here na medyo magkamukha. Yung isa, our outpatient dental surgery is covered by PhilHealth. So yes, if you have PhilHealth, pwede siyang, as long as updated siya, we have a PhilHealth office sa OPD. If outpatient and under local anesthesia naman gagawin, you may use your PhilHealth benefits for impacted tooth surgery. And then kung wala naman, I presented kanina yung okra, you can make a request there kasi lahat na ng patients namin ngayon, we deck them to telemed, yung mga non-urgent or mga elective cases. Tapos, what are the needed requirements? When the dentist calls you for teledentistry, sasabihin naman niya kung ano yung mga kailangan. Pero mostly, panoramic x-ray. Although, if wala ka pa, I advise na you'll get one once nakatawag na sa'yo yung dentist para bago rin siya. And then, meron ding onting service fee sa PGH, pero it's like 65 pesos, parang ganon. If meron kang medical social service or yung white card, wala ng service fee. And we just ask the patients to buy some of the materials, like yung suture, anesthesia, ganon, which are available din naman sa pharmacy ng PGH and sa department. Or kung gusto ng patient mag-scout ng mas mura, we can give them a list or a prescription. Pwede silang bumili somewhere like Bambang. Ganon. So there, I hope I answered the question.
Yes, okay. Thank you. Thank you so much po. We'll just go very, very quickly to our fun quiz. These questions came from the chair, but I will ask the correct answer from from the two assistant coordinators. Can we have it on the screen? Thank you so much. And can we have it on the Zoom also? The first question will be for Dr. Eris and the second question will be for Dr. Roland. First question, ano pong mga serbisyo ang ginagawa sa PGH Hospital, Department of Hospital Dentistry? Dr. Eris.
Ayun, sa presentation kanina ni Dr. Roland, nabanggit lahat to. So, pagtanggal ng impacted wisdom tooth, yan, araw-araw namin yung ginagawa sa PGH, pagbiopsy ng mga bukol sa bibig. Interestingly, minsan yung mga patients kasi dumediretso sila sa head and neck surgeon. A lot of times, or minsan sa plastic surgery, a lot of times, binabalik or nire-refer naman sa amin ng surgery para mag-biopsy. Kasi yung mga odontogenic cysts and tumors, minsan may mga technique para makakuha ng mga mas magandang specimen at mas makita nung Department of Laboratories natin kung ano yung mga histopathological features nila. Pagbigay din ng dental clearance sa mga cancer patients, ayun, para maiwasan natin ang mga komplikasyon ng chemotherapeutic drug or radiotherapy sa head and neck. Tinitingnan muna namin yung mga patients for dental clearance. So, sang-ayon din to dun sa mga international guidelines na mga sinusunod tulad ng NCCN. Actually, part na rin ng care, especially for head and neck patients talaga, yung dental examination tsaka dental clearance. Tapos, pagbigay ng paunang lunas sa dental emergency yon, we're very proud of our 24-hour dental ER. So, may mga iba-iba kaming klaseng patients doon, from bleeding to trauma. Ayun, ina-address din namin sila doon.
Thank you. Thank you so much. So, just for the record, it's lahat ng nabanggit po.
Lahat ng nabanggit.
Lahat po ng ano po.
Yes.
Thank you, Dr. Eris. And the second question is for Dr. Roland. Can we have it? There we go. Alin sa mga sumusunod ang hindi kabilang sa mga dental emergencies, Dr. Roland?
Okay, Dr. Sarmiento, so when you are talking about dental emergencies, you are talking about the urgent need, okay? So, masakit ang ngipin noong isang linggo o natanggal ng pasta. So, hindi tumitigil ang pagdurugo mula sa bibig, okay? So, considered po yan as a dental emergency. Natanggal ng ngipin mula sa pagkahulog, pagkadapa, or pagkabagsak. So, dental emergency din po yan. Okay? Especially with basag na panga, with dental emergency din po yan. So, the answer will be letter A. Masakit ang ngipin noong isang linggo o natanggal ng pasta. Why? Because when you are talking about fillings, dental fillings, or any other dental restoration, it's a very elective dental procedures. You can have it done by your attending dentist or by a private dentist. So, it's not considered a dental emergency po.
Ayun po. Okay. Narinig niyo po yun ha. Pag masakit yung ngipin, nung isang linggo pa po, natanggal yung pasta, hindi po siya emergency, para lang po malino. Thank you so much, Dr. Roland. I just wanted to emphasize that point. At this point naman po, we would like, thank you to the PGH Department of Hospital Dentistry really for an excellent po set of presentations and also the reaction from our chair, Dr. Estrada din po. Right now, we'll be showing our panel evaluation poll, and as I am reading the 5 questions here, I'd like each of you to come up with maybe a 1-minute or 2-minute message that you would like the audience to take away from this webinar po. No? If there's anything that they would want to take away, ano po iyon for each of your presentations and maybe in general din po for each of you. So I'll read the questions and then I'll call you right after po. These questions, as I mentioned po in previous webinars, we do not send out a separate evaluation poll. Ito na po iyon. It's a 4-point Likert scale for each of the questions, and we hope each and every one of you will be able to participate in this panel in discussion poll. Question number 1, the panelists demonstrated thorough knowledge of the topic. So do you strongly agree, disagree, or strongly disagree dito po sa statement na ito? Same for question number 2, the panelists were well prepared and organized. Number 3, the panelists spoke clearly and audibly. Number 4, the panelists used appropriate language with technical medical jargons adequately explained. And finally, number 5, the panelists contributed to new perspectives and knowledge on managing various key health issues. So we will keep this open and will not be closing this at any point until towards the end of the webinar na po, no? As we move on to the parting words from each of our panelists po. And we'll do it reverse chronological order. So we will start off po with the chair of the Department of Hospital Dentistry, Dr. Maria Cristina Estrada. Ma'am, you're on mute, ma'am. Sorry.
Yan po. Okay na,
Yeah po.
sir.
Yes,
Opo.
ma'am.
Para sa mga pasyente po ng PGA, Future PGH Patients Charity, pantay-pantay lang po ang tingin namin. So wag po kayo mag-alala. And we give really the best. Hindi ho kami nagko-compromise ng mga gamit, ng serbisyo. Charity is, wala po. Not that, hindi ho kami nagle-label. And for the future dentist na who wants to be trained, we always say na wala naman pinanganak na magaling agad-agad. And we don't get the magaling agad because this place will make you better. So, wag po tayong matakot mag-apply. Basta handa lang kayo sa mga future dentists po.
Okay, thank you so much. That's the chair of the Department of Hospital Dentistry, Dr. Estrada. We move on to the Assistant Coordinator for Service, Dr. Eris Navarro.
Una sa lahat, oral health is important. Part siya ng general health natin. So, kung mayroon kayong opportunity, please to seek dental consult. Importante yung magpa-dental check-up. At in relation din sa news kanina, iwasan din nating mag-smoking. Isa siguro sa mga general advice for the general public. Yung oral health awareness natin, and very relevant ngayon nga yung prevention or cessation ng smoking din.
Sorry, very, very timely po kasi yun po yung isa po sa ating mga news update po. Since World No Tobacco Day no May 31st that we mentioned earlier in the program. And finally, last but not the least, our Assistant Coordinator for Training of the Department of Hospital Dentistry, Dr. Roland Alvanez.
Yes, Dr. Sarmiento, gaya nga ng sinabi ko kanina, the Philippines has the highest caries level in Southeast Asia. So, tama po si Dr. Navarro, we need to be aware of our oral health status. Laging magpa-check sa dentista, okay? Twice every year to prevent caries prevention, to prevent caries formation. Okay, kasi importante po yun. Sometimes, nane-neglect po natin ang ating oral health status. So, we are just here, the Department of Hospital Dentistry, to cater your oral needs. Thank you po.
Thank you so much. Again, thank you. Maraming salamat. Deeply appreciate the presentation given by the PGH Department of Hospital Dentistry. Very thorough and very well prepared po. So thank you so much. You will also see yung kung ano kanilang appreciation kanina pa po through the emoticons and also sa ating sa chat po ng ating webinar. At this point, we will be calling in someone who has been really giving excellent synthesis and closing remarks po. She's the head of the Office of Expanded Education and Training, Philippine General Hospital, Dr. Stella Mariose. Dr. Stella?
Good afternoon, everyone. Thank you for attending our webinar from Dr. Roland Albanez, who is the Assistant Coordinator for Training of the Dentistry Division, Dentistry Department. He mentioned the services rendered by their clinic, which is oral surgery, and they have multidisciplinary services, telemedicine, and emergency dentistry, which we are the only hospital, PGH is the only hospital who has an emergency dentistry department or division. And it is greatly appreciated. For those of you who did not see this part, you can go back to the recording and you will see and you'll be impressed by the quality of service that the PGH dentistry gives. From Dr. Eris Navarro, who is the Assistant Coordinator for Service, she mentioned hospital dentistry in the time of COVID. And you will see that the dentistry department ensured the safety of both the patients and the dentist. So they have engineering controls, they have an air purifier and all the gadgets that the hospital provided with the other departments were also given to them. And that is, thank you very much to Dr. Gap Legaspi, because he really supported the dentistry division, the dentistry department. They also mentioned administrative controls, and the practices and procedures were changed. So they had telemedicine and telescreening and the use of PPE, which was very necessary in their field of work because their work is really aerosol generating. So they also mentioned that you can log in at OCRA through the https://pghopd@up.edu.ph. The chair of the hospital dentistry, Dr. Maria Cristina Estrada, who's the wife of my classmate Edgar Estrada, she said that the strength of our department is the patient trust in us. So I think that's a very valuable sentence or a statement. And you see that they have so many patients. And if there are so many patients, there are only 7 dedicated and reliable dentists in their department. They have good facilities, and as she said, there is no second hand. They all got first line or first class equipment. And now they have an increase in their trainees. And she said that only PGH has a dental PR, and I think that's a very good thing. So the plans of the dentistry department is they will soon have dental oncology on board. So that will be one of their next chapter in their department, and they will have training in oral surgery and of course dental trauma. Now it's becoming very common because of so many accidents, especially motorcycle accidents, and so that dentistry is a very important part of our care for our patients. Back to you, Raymond.
Okay, thank you so much, Dr. Stella Jose, who is the head of the PG Expanded Education and Training Office po, no? Thank you again to our PGH Department of Hospital Dentistry. You will note po, even though we have not yet closed it, almost half of the participants here in the Zoom at least have participated in sa panel discussion poll, and I would say this is probably the highest set of scores that we've had for a webinar po, no? At least 95% of the webinars of the participants graded po na mataas po ang kanilang scoring for this webinar. Just goes to show, marami po silang natutunan, very well prepared, and marami po talagang interesado din po sa hospital dentistry. So thank you again. Thank you for Dr. Stella for coordinating din po. And we will not be closing this evaluation po hanggang sa dulo po. We recommend that everyone participates in this evaluation poll. But before we formally close this webinar, meron lang po tayong reminder. Please continue to watch us on the playback at the TVUP YouTube channel and the TVUP Signal TV Channel 101. Okay, next week po. Next week, we will be having the Department of Surgery. Department of Surgery naman po. we're not yet aware kung ano po ang kanilang interesting topic, but hopefully that's something that marami po ang will tune in and be very, very interested in learning more about what happens and the innovations po, no, of our surgeons here at the Philippine General Hospital. We also like to remind you that all Stop COVID Deaths webinars 1 to 147 and then thereafter today 148 will be archived for viewing at the TVUP YouTube channel. So you will just need to go to www.youtube.com/TVUPPH for you to be able to see all of this. Ako po, panonorin ko po ito dahil hindi naman po mahilig po ako sa mga ngipin, but just wanted to make sure na yung pong mga nakita ko kanina, correct po, no? Especially yung mga presentations from Dr. Albanez and Dr. Navarro. Interested po kasi ako lalo kapag may mga before and after pictures that really piques my interest in terms of that. We also understand that everybody's very busy, so we have selected presentations that we feature po as SCD shorts that we call. These are very, very short consumable videos, maybe 1-2 minutes thereafter po, no? If you're a regular sa YouTube, obviously you'll be able to see this, youtube.com/TVUPPH. Yung mga nuggets of wisdom that you can pick out in these very, very short videos, you'll be able to see that. Again, as I mentioned, whether naghihintay po kayo ng inyong kape sa barista, whether you are waiting in the na kayo po ang next po sa dental chair, whether you are waiting po na matignan po ng inyong next na dentist, pwede po kayong manood dito po sa ating YouTube channel ng TVUPPH. So this formally closes our webinar for the week. I hope si Dr. Stella masasabi nyo kay Dr. Susie. Magkita-kita po tayo again next week sa ating next Friday from 12 noon to 2 p.m. It's a date.
Together, we will stop COVID deaths.
So keep safe, keep healthy, and see you online.